Hello and welcome to our fifth installment of our weekly regional report outs. This is the Kansas City Metro region here every Tuesday at 1 o'clock and also available if you go and sign up on the website at covid.ks.gov/report-outs. You can put in your email address and get this sent to you anytime. We like to start with the dashboard. We'll have a part of our focus today will be on vaccine on the later part of the call after we kind of get an update from everybody. But let's start, as we like to, with the dashboard. Let me pull it up real quick. Okay. So sorry, let me get my papers organized here. As you can see, a little bit of relief being created compared to where we were. The up-to-the-date stats that Dr. Weil brought on last week had us at 15% capacity. This is as of this morning. We were at 20% capacity of adult ICU beds. Also, when I look at the census week over week from where we were, we had 904 hospitalized, confirmed or suspected COVID patients in the KC Metro. This week we're at 863. Last week we had 115 adult staffed ICU beds available. This week 121. And so that's good news. That's moving in the right direction, though. That's a little bit of relief. A little concern here just below that as we see the total case numbers spiking back up kind of near where the peak has been for this region. Peak back here at 4,400 in 1 week, but the 4,165 this past week. So we'll be keeping an eye on that. And then you can see the percent of the population that's tested positive and the breakdown in ICU beds. So now with all that pointed out, also hospitals anticipating staffing shortage. That's a 24% coming out of the holidays, and hopefully with the vaccine rolling out, we're seeing a little less of a pinch point there. But we'll get an update here from our friends on the ground. So let me kick it over to our friend Steve Mayhew, who was at a live vaccination clinic last week. Just give us an update from public health perspective, Steve. And you're muted still. Yeah, thank you.
There we go. Sorry about that. Steve Mayhew with the Johnson County Department of Health and Environment. Just to give a public health update on the region, as John pointed out, the numbers we did see kind of dip around Christmas time, but if you look from Christmas on, that trend line is heading upwards again. I do know that within the department in Johnson County here this week, we are seeing numbers that are as high as they were before the holidays. And so we kind of expect that line to continue upwards, hopefully not too high, but I think that it's going to we're going to see it level out from, and we'll see that those dips around the holidays may not be representative of the disease that's actually in the community. It might be artificially low. One thing that we are doing in addition to all this testing and looking for COVID in the community is our vaccine clinics. And so the health departments in the KC Metro are hoping to receive, at least most of them, their second shipment from the state. We received our initial shipment the week of December 21st. And so since then, I know some more vaccine has gone out to hospitals and federally qualified health centers. And so we've been working with those initial doses, have since given all of those. And one of the things that I want to point out is while we're not yet receiving additional shipments from the state, we are in all three of the counties in the KC Metro working with our hospital partners and healthcare partners to identify where vaccine is and how we can get it out to those who need it. And so just an example of that is, I know we've received vaccines, as has Wyandotte County Health Department, from their federally qualified health center to get out to healthcare workers. And so through those partnerships are able to get vaccine out into the community quickly. We at Johnson County are also partnering with KU. They have given us some vaccine, but they are also opening appointment slots to healthcare workers in Johnson County. And we're helping facilitate between a list that we have of healthcare providers who are interested in receiving the vaccine that we've been keeping track of, are able to align that with vaccine appointment slots that they have available. And so while we may not be getting these direct shipments, we are still doing a lot of work with our partners to try to get vaccine to those people who need it. And I know that's happening in all 3 of the counties in the metro area. We do anticipate receiving additional vaccine from the state this week or next. From there, we hope to vaccinate again as many of the healthcare workers in phase 1 as we can. And so hopefully we can move into phase 2 as quickly as possible. And so from a public health standpoint, it's still trying to, we get the vaccine, we have it, in our hands for maybe a day or 2, and we try to turn around and get it out there as quickly as possible. But that day or 2 just gives us time to schedule something so that people have time to obviously make their appointments and keep them. And so it's a fluid situation. It's rapidly changing. But I think the workforce, not only in public health, but the partners we've engaged with, has been incredibly flexible and adaptive. And so just wanted to let people know that as we get vaccine, it gets out there, in my opinion, at a pretty impressive clip. And so we're really proud of that.
Now, I know the state has rolled out their strategy, and that's what Seth is going to go into for us. But there will be a county by county level of discretion inside of all this too. Has the region or Johnson County announced what their plan is? Or are they working on that now?
In terms of sort of a sub-prioritization as we get into these larger groups where the amount of vaccine certainly isn't enough to get to everyone. Yeah, that's obviously a major challenge that we have. We're all working off of the guidance that we received from KDHE. I don't know. So there are discussions obviously about sub-prioritization, but really when you look at the guidance from the state, everybody in phase 2 is needs a shot as much as anybody else in phase 2, the way it looks right now. And so there are discussions. If there's further guidance from the state, we will obviously consider that. But really our main focus isn't every single individual who gets it, but how much can we get out there as quickly as possible? Because the more vaccine into the community, the better, as long as it stays, we still want to fall into those tiers, but we'd rather give vaccine than hang on to it for too long.
That's great. Let's pass it over to Kenny.
Okay, thank you, John. And I know Bryant is on with us, so I think we'll let Bryant kind of speak for the Kansas City Metropolitan. I'm Kenny Welk, University of Kansas Health System. So I'm going to toss it to Bryant and then let him talk about the metropolitan area. Then I'll add a little color commentary for Kansas and specifically the University of Kansas. So Bryant.
Thank you, Kenny. Again, Bryant McNally with the Kansas City Metropolitan Healthcare Council. One of the things I think you see it right there in the data, which is kind of a plateau, really. Numbers aren't going up, they're not going down either. It's kind of everything's holding steady. And while on the one hand, that's disheartening because, the spread is still continuing at high rates. On the other hand, it's a level of care that we've been able to be, that has been able to be managed throughout the community. And so while there's a lot of stress and pressure on the system, it's still very manageable by the hospitals in the community, as you can see. And then, with the staffing, those are just one of the things that it's going to take a while until the staff have been fully vaccinated and we begin to have less out with quarantine and isolation and the like, and are able to, bring that back. There's always staffing challenges that hospitals face, but when you add, the handful of staff that are out with exposures, that's really, it pushes you over that edge. Hospitals run with a pretty lean inventory of staff and supplies and the like. But, and then speaking of supplies, those seem to be hanging on pretty well for everybody. I know there's some impending concern about gloves, if that's going to be, a pressure point just due to the production facility challenges that occurred earlier in the year. And then also knowing that, gloves and needles and syringes and the like are all necessary components of administering the vaccine. So, your burn rate or the amount that you use continues to go up with this new added pressure on the system. And I think that's really the last thing to hit on is, the vaccination programs that are going in place. Everybody's trying their best to follow along with the guidance that's been shared. Obviously, each state's a little bit different on how they're deploying it, who's being given the vaccine first and foremost. But really, the most impressive thing, I think, is the the desire by those that once they crack open those vials, they get them all delivered and get them into arms, and trying really diligently to reduce any wastage that may occur with that. And then, as we've seen with some recent changes at the federal level in terms of proposals to maybe go ahead and release all the doses, I think that's going to create some stresses on the system in terms of there's going to be more available to give, but then there's also the logistics of, okay, am I going to receive everything downstream for further distribution for that second dose that's needed. So, those are the kinds of things that hospitals are working through, just operationalizing and dealing with on a day-to-day basis. But I think, when this started a couple of weeks ago, we really were feeling like we were at that tipping point. And today, it feels that we're off that top. We're still, up in that top 10% of where we really want to be as a community in dealing with this. But that pressure that it feels like we're just, one day away from tipping over the edge, feels like it's being relieved a little bit. And I think that does have to do with the continued practices of the social distancing or the physical distancing, the masking, hand hygiene, and now you add vaccines. So another fourth safeguard in there that is kind of acting as a pressure relief valve. So with that, I'll kind of give it back to Kenny and get a little more direct response of what's going on with the University of Kansas Health System. So Kenny?
Yeah, so thank you, Brian. Again, Kenny Wilk with the University of Kansas Health System. I think Brian really captured it well, and frankly, we're pleased. We still most hospitals across the metropolitan region are certainly running close to capacity. Still have a lot of non-COVID patients. It's always important to put that on the table, but we also, we're about 3 weeks out from Christmas now. So when we talked even last week, we were really pretty concerned what that might look like. And the COVID patients, and I can certainly speak for our hospital, has been manageable. At one point between Christmas and New Year's, we were at about 170 inpatient. That number this morning, John, was about 115. So that is good news, and it's been running between 112, 115 up to 130. I would say we are experiencing sicker patients in the hospital. So of the 115 that are in, if you were to take a snapshot of that 115 and back up even 4 or 5 weeks, what we would tell you is that the 115 today are on average sicker. But we're managing that. We'll continue to do that. Also on the workforce side, and again, I believe I can speak for most hospitals. All of us, 6-7 weeks ago, we were really quite concerned. The numbers were pretty high. Those numbers have come down across the system and across the metropolitan area, and that's all good news. And let me touch for just a moment before you switch it over to a larger conversation of vaccinations. Most people know hospitals have been some of the first to receive vaccine. We are most grateful for that. We're in the process, as are most hospitals, and most of the hospitals, maybe not all, but most of the hospitals have had the ability to offer to those that want a vaccination their first shot. So again, most of the staff in hospitals, and there's been some questions about that. That's not all direct, but that's actually all the people in hospitals. So it's not just those people that have direct access, but it's important for folks to understand it really takes a team to run a hospital. And the example we use, if for some reason we lost our support staff in IT to run our hospital, it would really be a really hard period of time. So trying to make sure the full team is going to be available to be on the field is really important. We're making progress on that. We pretty much got everybody through a first shot, and we've actually started some second shots of the Pfizer. Started some of those last week, and we'll continue that. And through the month of January and into February, we'll be running second shots. We have, as I think Steve was saying, our hospital, along with other hospitals, there are hospitals that have some extra vaccine, and we are all trying to do our part to make sure that that's just not sitting around, that we're actually getting vaccine into arms. So we stand ready, as I believe a lot of hospitals do, to not only try to work together on the vaccine, but make sure that we have the clinics. We did have some calls last week, and I would just say for the listeners, I'm not quite as familiar with the Missouri side, but Johnson and Wyandotte County and their public health offices, I think, have some excellent plans in place. So as the vaccine continues to become available, they have put a lot of thought into this, and I think it's going to work really well. So it's just a matter of the supply ticking up, and as that continues to happen, hopefully we can all continue to make progress and get to some sort of normal summer. Let's hope, at least, John. So I'll throw it back to you.
Let me just ask one follow-up question before we pass it over to Seth here. How do you guys feel about staff morale? That was a theme that came across last week across the state. Is it getting better, or is it seemed to have hit a low last week as far as what I could tell?
I think, thanks for asking about that. I would not say last week. I'd say, Christmas, right around New Year's, which I guess is last week. Absolutely. But I got to tell you, with the rollout of the vaccination, it seems to be giving everybody a lift. And we got our numbers down. We got far fewer folks out now, so that helps. At one point we were really stretching the staff pretty thin. I would tell you, and I think, and this is worth saying, I think all hospitals are in this boat. We have had a number of deaths, and that's really hard on the staff.
And that would follow the November spike. The deaths you would have seen over the holidays and late, just after the holidays, would have been related to that as far as the 6 to 8 week trailing.
That's correct, and we're sure hoping that peaks out. That's been extremely difficult on the staff, but I think a combination of a little fewer patients in the hospital, the vaccines coming across, and having more of our workforce available. You put all those things together, and I think it's helping. Brian, do you have any other feedback on that?
Okay. Seth, do you want to show yourself and unmute yourself? So Seth Conkle is working with the state. He's from down here in Wichita with me. In Sedgwick County, has been in public health for a long time, is now contracting inside public health, and has been helping Sedgwick County, is helping the state really help work out the whole vaccination process from beginning to end. He's going to walk us a little bit through that. We want to dedicate some time just to build the understanding around how this process might look the next few months. And so I'll pass it to Seth. Seth, you can add anything to that introduction that you'd want, and I can make it even better on the next call. So let's pass it over to you, Seth, and I'll make you so you can share your screen as you introduce yourself.
Okay, thanks, John. So actually, my role is kind of a special advisor to the governor, helping with the efforts from the governor's office and with KDHE on the vaccine rollout. So what I'm going to share today are a couple of things. We're going to talk about some definitions that I think have caused some problems for us in the last couple of weeks in terms of people understanding the numbers and the data and why Kansas was originally reported to be in the bottom tier, or at that point, the lowest state in the nation in terms of vaccinations. And then we're going to jump into some resources that have recently been released and look at some numbers. So I think the first thing that we want to cover are, again, these quick definitions, just to make sure everybody's on the same page as to how those statistics are going to roll out to you. So allocation, again, that is the process of determining how much vaccine a provider, a county, a doctor's office gets. That happens at the federal level down to the states, and then it happens again at the state level, where we determine at the state level, or KDHE determines at the state level how much vaccine each provider is going to get. And then again, that could happen within each county. They could be turning around and transferring or allocating doses to other providers as well. So it's just simply the process of identifying the group, the distribution, and this is where we have some lag in the data. The distribution is that physical movement. So think of an Amazon warehouse, it actually getting to you is the distribution process. So getting from the feds to the state, from the state to the locals, again, we're talking distribution there, and then dispensing, the process of actually getting the vaccine into people's arms. So that's where you're going to see vaccine administered or doses administered, is a reporting statistic that we're seeing a lot of. And then I think the last thing that is maybe causes some confusion is then point of dispensing. And this is a term that's been used by public health for at least a decade now, if not longer. And that's just a location where residents can go to get their vaccine. So again, that's probably a very public health term. Another term would just be a vaccination clinic or a vaccine clinic, a pharmacy, the place where you go to get that. So pods are generally more common surrounding the idea of mass vaccination, where we're trying to do a lot of people at one time. So a couple of the areas where we see some data lags are, for example, on a weekly basis, the state is getting a new allocation of vaccine, but it doesn't hit the state we don't physically have it in the state for anywhere from, I would say, 4 to 7 days. However, some of the data that's being reported at the federal level already has those numbers included into it. So by the time we get through all of that, we receive the vaccine, the local provider receives the vaccine, they administer it, and then it gets recorded into the state's immunization database. There's a fairly large amount of time that occurs there. So then I think that hopefully helps kind of outline why we're seeing some data lags. I think the next piece that I'm going to jump into is the new website that has been shared by the governor last week. I'm going to shift screens real quick. This website is, sorry if I can, my computer's going a little bit slower than I am. Here we go. So it is kansasvaccine.gov. So this is the website where you can go as a resident of Kansas to get information as it relates to the COVID vaccine. So as you can see, again, we talked about the doses administered right here in the middle of the screen. We're seeing a little over 84,000 doses administered. So I think that's an important piece to remember. There are still doses sitting on shelves. There are probably still doses that have been allocated to the state of Kansas that have not been dispensed yet or put into somebody's arms. We are quickly working to make that gap as small as we can. I think the other big question that we've been receiving is, where do I fall out? So there's some information here about vaccine safety. There's some FAQs, and there's just some more information that you might find in determining facts versus fiction here on the right. But ultimately, most people want to know, where do I fit in this priority list? And then secondly, where and how can I get my dose? So if you jump over to the availability page, you're going to see a couple of options. We're going to look at two links on this page real quick. I'm going to spend most of my time here on an overview, which may have been seen in the last week, where it outlines who's in phase 1 through phase 5. Currently, we are only, as a state, offering vaccine to those in phase 1.
We'll attach this to the email that goes out too, just so you know, Seth. But are you able to make it bigger on your screen?
Yep. Let me zoom in on it.
Thank you.
So we will currently, we're doing the phase 1 very soon. Again, down here, you can kind of see the timeline. By late January, we absolutely anticipate being able to be into phase 2. And in phase 2, that's where you're going to see people 65 and older, congregate settings, high contact, critical workers. And then we're still vaccinating anybody in phase 1 who has not received a vaccine yet. So obviously these are very large categories and have very specific definitions of them. This one document is just more of a visual. So I'm going to take you back to that same availability page at kansasvaccine.gov. And down here, the second page where it actually talks about the plan, that's where the definitions are. So you can scroll through. There's just some kind of methodology behind this. A lot of thought has gone into this. And you'll see, again, the same or very similar graphic. And then we get down here into more specifics of the definition. So on these pages for phase 1, I'm actually going to jump down to the phase 2 high contact critical workers. You see a definition. Really, if you fit into this definition, then you can be vaccinated in phase 2. You'll see some descriptions, again, some of the information that went into helping to make that definition, and also you'll see some examples of groups. Just because you as an individual or a group that you're a member of don't fit into this group, this was just to help people kind of mentally align who fits into this group, but ultimately it comes back to the definition. So if you don't fit into phase 2's definition, then you should look at phase 3's definition. And ultimately you'll continue on until we get to phase 5, where it'll basically be vaccine available for everybody. So right now, this is going to be the best place to go to get the information that you need to understand where you're at. And then this is the same website where very soon you should be able to go to see where, again, after we look to expand past phase 1, where you are able to jump in and get an actual vaccine from. So, John, I think those are the highlights of kind of where we're at with vaccine and the vaccine rollout, but definitely look forward to coming back on soon and being able to share more information, but would definitely refer people back to this kansasvaccine.gov. I can never remember if it's .com or .gov for information.
All right, we'll put that website onto the email also. Thank you for sharing it. I know there's been a lot of questions about this. Governor rolled it all out this week. And Seth, thanks for your service to the state, just helping to organize all this as it comes into the state and gets out to the individual counties, and just making the big wheel turn. Obviously, there's hitches in the giddy up, so to speak, when you're trying to do something of this scale, this fast. So I just encourage all Kansas to have grace for the people that are working in this. The heart is the same to push this thing out. We all know really that we're in a race against time, as there's a more contagious variant out there somewhere. And obviously the more people we can get this into their arms, the better. Anything, Bryant, Kenny, Steve, you'd want to add to Seth's comments?
No.
Nothing here.
Okay. Seth, you were that good. I mean, it's tough to get Kenny to stay quiet. So, hey now. All right. Hey, it's good news. It's the numbers are holding steady and manageable. I like the way that you said that. People need to stay in it. Bright spot for this week for me was getting to see the Mitch Holtis spot that came out this past week, just encouraging, wearing the mask and all that. We're going to attach that to this email just to show it out there with the Chiefs. He just really did a great job framing it up. So everybody, hope you have a great week. We'll be here same time next week, 1:00, Kansas City Metro. Please sign up if you haven't already at covid.ks.gov/report-outs.